World Hour, unpacking global headlines from an African perspective.
And it's 7 minutes past 9. Let's go straight to our top story this hour. And it's about the rising Ebola outbreak in Kasai Province of the Democratic Republic of Congo. Joining us now is Dr. Otim Patrick, Program Area Manager for Emergency Response at the WHO Regional Office for Africa. Dr. Otim has extensive experience managing Ebola outbreaks, including in Uganda and Sudan. And he joins us now to speak to us about the latest outbreak. A very good evening to you, Dr. Otim, and thank you so much for speaking to us.
Good evening, and thank you for having me.
So we understand that the Ebola cases that have been reported in Kasai have doubled in a week. Can you just share with us the WHO's immediate actions to contain this outbreak and what has happened since it was detected?
Thank you very much. Yes, so just to start off, I think where we are today, based on the latest data, we have 25 confirmed cases that have been reported in the Bulapi Health Zone of Kasai Province. And out of this, unfortunately, we have so far lost 14. And so we have a case fatality ratio of around 56%. So yes, the outbreak is concerning at the point where it is. And in the last 1 week, we have been accelerating efforts so that we can be able to contain this. We have done a number of things. One, in terms of establishing coordination at the field level, we have supported the Ministry of Health and working with other partners, we have deployed senior emergency management experts on the ground now in Bulapi who are working to try to organize the different pillars of the response from surveillance, contact tracing up to safe and dignified burial so that we have a full package of intervention being implemented. Secondly, protection of healthcare workers and ensuring that we have the right supplies for the response. And then we have deployed 12 tons of supplies that have also been delivered on ground so that we have the appropriate PPEs, the medicines that are required for the symptomatic management and all other relevant supplies. The third is really trying to ensure that we have appropriate clinical management of the patient so that we can reduce on this high mortality. And therefore, we have deployed experts who have experience in managing Ebola cases, and they are working with their colleagues on ground to try to improve on the quality of care that is being delivered. And then in addition to this, vaccine is a critical tool which has become available for this species of the Ebola virus, and therefore the vaccines arrived on the ground today, and we expect that tomorrow they will start the vaccination so that we can target the contacts and their contacts as well as the frontline healthcare workers. And then a critical aspect of this response is engaging the communities so that they can be able to understand what are the risk behaviors that can increase their chance of catching the virus, how do they protect themselves and their families, and how can they be able to work together with the responders to prevent further spread of this outbreak. And this community engagement has been intensified across all the communities where cases are being reported from.
Given what you've said, Kasai is remote and with poor infrastructure. How much of a negative impact has this had on response efforts?
So yes, Kasai is particularly the Bulape health zone, which is the hotspot now, has been very, very difficult to access. It is more than 3 days drive from Kinshasa to be able to reach there. So it really slowed our initial action to be able to get the teams and the supplies on ground. Otherwise, we would have been much, much ahead now in terms of the response. But in the last 48 hours, we've made significant progress working with our colleagues in WFP and the UN mission to DRC, MONUSCO. We have been able to position a helicopter which started operations today, and it started airlifting the vaccines, the personnel to the ground. So now we are able to move much faster. We have cut this distance, which used to take 3 days to now hours, and we are moving the supplies and the personnel to the ground. So we should be able to catch up with in terms of the time that has been lost in the last 1 week.
And I want to look at the 4 districts where the outbreak has spread. And if the figure is correct or incorrect, please correct me. I understand that it's claimed 16 lives thus far. What is the death toll, and what are the major factors that are driving this rapid spread?
Okay, I know that we have received reports of suspected cases from other health zones, including Mweka, but the confirmed cases now are concentrated in Bulape Health Zone. So the others, there have been suspected cases which have been investigated and the results came out yesterday negative. So all the confirmed cases are concentrated in the Bulape Health Zone. The other neighboring health zones are, of course, at high risk of spread, and we are stepping up surveillance, but there has not been any confirmed case from those health zones. Now, as I mentioned, we have had, unfortunately, 15 deaths that have been reported, and the deaths really are driven by two factors. One of it, of course, is that some of the cases have been identified late, and they presented to the facility late, so it was the appropriate care, which is the optimized supportive care they're supposed to get, was initiated late, so we couldn't manage to save them. Of course, in the early phase of an Ebola outbreak like this, when you are rushing to try to establish the appropriate care, unfortunately, usually there is high case fatality. But once we get everything in place, we have brought in the monoclonal antibodies, which are specific for this Ebola Zaire to be used. We are optimistic then that within the coming days we'll be able to keep this case fatality ratio low.
And in terms of what do you call local movement patterns and cultural practices, are they in any way influencing transmissions, and are there examples that you can share with us if they are indeed doing so?
Yes, so one of the early things we are seeing, for instance, in Bulape, one of the big chain or cluster that we are seeing was related to, there was a burial ceremony that took place of one of the early identified cases. So this is a burial that was done in an unsafe manner, and people didn't know that time that it was Ebola, and a number of people gathered and attended this burial. So as we have seen in previous Ebola outbreaks, unsafe burial can be a super spreader event because many people come, and usually in our African cultural context, a lot of people come in contact with the body in terms of preparation for burial, and even during the vigil, many people come in contact with the body. And the body of someone who has died from Ebola is a super infectious. So it is one of the things that we have seen that has been responsible for one of the biggest clusters that now is being investigated within Bulape. The second issue is that we have also seen that women, as has been in other outbreaks, women are more affected. So 55% of the confirmed cases so far are women, and 67% of the deaths so far are women. This is because the primary caregivers in the household are women, so they provide more of the care. So when people are sick in the house, they are more close to them, and therefore they get affected. So it is the caregiving at the household level. It is other high-risk exposures like the FINRO, which are some of the drivers, and those are the things that we are trying to address in the risk communication and community engagement that is taking place.
Now, as I mentioned in the introduction, that you have a vast experience in different countries dealing with Ebola. From that experience and the strategies that were employed in previous outbreaks in the DRC and other parts of the continent, are the same strategies being applied, and is the type of strain evolving, mutating in a manner that challenges how you're approaching what is happening, for instance, in the 4 counties that we mentioned, particularly Bulape, as you mentioned?
Thank you. So in terms of the strategy, when it comes to Ebola Zaire in specific, which is the one that we are dealing with now, the strategy that we have adapted in the last few years with the vaccine being licensed and also therapeutic being available. So really it rests on 5 critical tenets. One is we have a very good case investigation surveillance system where you are able to identify and list all the contacts and follow them up. This is the initial step, which is very, very important, so that you are able to map your chain of transmission. And if you don't do it well, you miss a contact missed today becomes the case tomorrow and infects other people. The second one then is the community engagement and risk communication, which we are doing now, because if people do not cooperate with the response measures, if they don't present to health facilities, if they don't call the alert number and they stay in the house until when they are very sick, and then it becomes very, very difficult to save their lives. But more importantly, when a sick person stays in the house, the contact rate, the interaction between the person and the people in the family increases the chance for further spread. The third one is the infection prevention and control measures, including the safe and dignified burial. So ensuring that in all the surrounding facilities, there are screening of people coming in, because Ebola initially presents like the common illnesses we know. It presents like malaria, like typhoid in the initial phases. So it's very difficult to identify early. So there has to be a measure to be able to screen when you are in an area where we have active outbreak. And then you implement hand washing, hand hygiene, you put appropriate PPE for the healthcare workers, so that they can be able to protect themselves. And then when a person dies, we ensure that it's buried in a dignified manner by a trained team, so that they don't infect other people. The fourth issue is then the early initiation of care, so that the people can be rushed to a facility, designated facility where there's appropriate level of protection. They are managed with an aggressive supportive care. And then lastly, the other arm is now the vaccination. So the vaccination for Ebola Zaire specifically, we use the ring approach, where we identify a case, we list the contacts around the case, and then we list the contacts of these contacts. So we do what we call the ring vaccination strategy. So we are making a ring around this case. And this is the same that we are going to apply in this. We have applied the other 4 elements. The vaccination was the one remaining, and we are going to start that since we have the vaccine on ground now.
Well, thank you so much for speaking to us, Dr. Otim. Much appreciated your time and, of course, your insights. Dr. Otim is from the WHO Regional Office for Africa, and he's been speaking to us about the latest Ebola outbreak in the Democratic Republic of Congo. He is Program Area Manager for Emergency Response. That brings us to 19 minutes past 9. You are listening to Africa World Hour, and thank you so much for watching, listening as you've just joined us. We have quite a number of issues to talk about. We'll be looking at Burkina Faso's move to waive visa requirements for African countries, what this means for economic development and trade. And of course, we're going to have a 21 feature on a Friday. We usually talk music, and we look ahead to the Standard Bank Joy of Jazz.